Rad Magazine, the voice of medical imaging and clinical oncology. For 50 years, Rad Magazine has been the leading publication in its field and has a wide and influential readership. Rad Magazine works in partnership with AXREM, offering members reduced rates on RadLink. Check out your members' document in your weekly newsletter. And it is also the proud sponsor of the UKIO AXREM Drinks Reception. Find out more about Rad Magazine in the link in the show notes. Welcome to AXREM Insights, developing healthcare through medtech and innovation. Join Melanie Johnson and Sally Edgington as they talk with our industry leaders and experts.
Hello and welcome. I'm Melanie Johnson and I'm here with Sally Edgington. Today we have the pleasure to be speaking to both David Kynaston, Sales Manager at BrainLab and AXREM's Radiotherapy Special Focus Group Convener, as well as Daniel Baines, Country Manager and Sales Director at Elekta and AXREM Special Focus Group Vice Convener. So welcome David and Dan, and thank you for being on our show today. Now let's get started by handing over to you to tell us a little bit about yourself and what's your story.
Yeah, so first of all, thank you for having us. It's great to be here and it's great to see you as always, or hear you as the case may be. So my name's David Kynaston. I'm the UK and Ireland Manager for BrainLab. Obviously, I've been working with AXREM now for a number of years and under the close guidance of Dan as the convener for the group. In the last few months, I've taken over this role and with Dan's support, looking forward to leading the group into the future. And I think it's been a great experience so far working together, and we've already seen some positive steps. And I think, yeah, it's good to continue this into the future. I guess I'll hand to Dan to do a proper introduction of himself at this point as well.
Brilliant. Thanks, Dave. Yeah, so I'm Dan Baines. I'm the country manager for Elekta for the UK and Ireland. And I've been working with AXREM for many years now, alongside my colleague, Richard Coldrick. And I've been supporting AXREM and obviously the activities that AXREM do with Radiotherapy UK. And then I got really interested in the Radiotherapy Special Focus Group. And then I was lucky enough to take over from Adele, the previous governor. And I was convener for a couple of years for the Special Focus Group. And then I've been able to hand the responsibilities over to David. So really looking forward to how AXREM and the Special Focus Group is going to move forward from here, really.
So tell us a little bit about your history before where you've been at the moment. David, what's kind of your history, your background? How did you get into this?
So from my perspective, no clinical background at all. I've had quite a convoluted journey to where I am today. I worked for Philips previously, and I was more on the imaging side, which again, I know work very closely with AXREM, and we have a special focus group for that as well. I would say a person that Dan is probably quite familiar with, Sean Atherton from the Christie, is to blame for my involvement in radiotherapy. So when I first joined Philips, not having a clinical background, he was very keen for me to understand a bit more about the sort of complexities of radiotherapy when you compare that to a more diagnostic environment. And he invited me in, and I spent quite a bit of time in the department looking through making masks, planning, and then time on treatment. And for me, it was a very, very interesting journey to see really the differences from what I knew of imaging as a patient through to obviously the treatment side of things. And yeah, then the opportunity arose a number of years after that for me to join BrainLab. So I still get the privilege of working with Sean. So he hasn't managed to get rid of me just yet. But yeah, it's been a very, very interesting journey. And I think it was quite enlightening because you don't know what you don't know. And from the Philips perspective, we delved into the radiotherapy environment from a CT perspective and also from a planning perspective at the time. But yeah, my knowledge was quite limited, and it was a big learning curve when I first moved to BrainLab to understand really the breadth and depth of radiotherapy as a whole. And yeah, it's been an amazing journey. I think I'd say there's still a lot for me to learn. It's an ever-evolving environment. And yeah, it keeps you on your toes. So it's been an exciting journey so far. And I look forward to what the future brings as well. And I think that's a key part of what we do as a group, is trying to sort of shape that future with technological advancements and what we can do to help expand the care that we give to patients.
Now you're a font of knowledge.
I wouldn't go that far.
Super. And Dan, what about you?
Yeah, so I was quite surprised. I'm in my 26th year in healthcare sales. I started way back in 1999 in pharmaceuticals, working for Glaxo, Wellcome and Pfizer. And then after a number of years selling pharmaceuticals, I really wanted to move into sort of capital equipment and diagnostics. I always wondered what happened to patients once they've been prescribed medicine, or how they got to that point. So I moved across into selling contrast media for X-ray, CT and ultrasound. And again, through doing that, I got really, really interested in the cancer patient journey through the healthcare system. And it was at that point I'd spent enough time diagnosing and helping diagnose patients that I was wondering what happened next. So I was fortunate enough to move across to Philips, and then from Philips, I've been at Elekta now for 8 years. So very much at the front end of cancer delivery and radiotherapy. And it's for me, I feel like I'm home. And as David mentioned, there's so many characters in radiotherapy, and it's a very small, close-knit community in radiotherapy in the UK. Even though we've got the 49 radiotherapy centres in England, everyone knows everyone. It's a really nice area to work in. And because it's at the healthcare provision, the real treatment side of healthcare, everyone's got a similar mindset. It's all very patient-focused, and that's what appeals to me and keeps me at Elekta and keeps me focused on radiotherapy.
Yeah, we do notice that actually everything is very tight knit and everybody seems to know everybody. So it is lovely. And obviously, on a personal point of view, I know that you're both avid cyclists as well. So what is it? Roads, mountain biking? What are we both into?
Well, if you start off with Dave and I always have conversations and competitions. Dave's got more broken bones and scars than I have from cycling. I don't know whether that's a boast or shows how extreme he is, but I'm both into road and mountain biking. And I often go to Dave for advice on tyres and what to do and what not to do and which components to buy. But go on, David, over to you. Which do you prefer? Is it road or off-road?
Sorry, I was just going to come in there and say it sounds like David needs more balance. It sounds like Dan's got better balance than David.
I mean, I'm not going to disagree. I'll be honest. I've hit the floor or trees or various things far too many times than I can count. From that, you can probably guess mountain biking. Otherwise, I'm getting very adventurous on a road bike if I'm in the trees. But it's I've been doing it for a good number of years now. I was fortunate enough some time ago to race for Team GB and travelled the world doing that. So yeah, it was good. Then I got worse. Then I started crashing and breaking things. And now very much it's for fun. The road bike does come out every now and then to make me feel a little bit better after a few too many cakes. But my ideal scenario is a mountain bike and a ski lift. Take me to the top on the ski lift and ride back down. That's the right balance for me.
And we wonder why you have broken bones.
Yeah, I was going to say extreme sports. I can tell that you're both extremely passionate about radiotherapy, and I see that across our membership. And most certainly, I think in the radiotherapy special focus group, that really shines through that everyone's in it for the right reasons. So I think it'd be nice for our listeners now to really understand a little bit more about what the special focus group priorities are, and maybe talk a little bit around the manifesto, which I know we refreshed, Dan, and we relaunched back in November 2023, and the title of our manifesto is Driving Towards a Modern World-Class Radiotherapy Service. So I'll hand over to you guys. I don't know, Dan, because obviously you were convener at the time that we launched that, whether you want to start on the manifesto, and then maybe David, you can talk a bit about the kind of current priorities.
I mean, I think it's a really interesting point where the manifestos come from, where the special focus group manifesto is now, and looking forward where we're going to take the manifesto with David. And I think it's reflective of the changes in radiotherapy. Radiotherapy has always been changing and innovating at a really rapid pace, but it's the ability to sort of keep track of the innovations and then translate that into patient outcome and benefit within the NHS. So if you look at the manifesto that we did it last year, looking at the outdated machines, the low number of linacs per million of population, the barriers to adoption of new technology, and the funding cycles that we go through. So really highlighting those in the manifesto, and that was very much what was needed then. Obviously, since then, the political landscape has changed quite significantly. We've got a new government. We currently haven't got a national cancer plan, but obviously Ashley Dalton, the MP for Lancashire, is obviously developing the new cancer plan. I'll be really looking forward to reading that. And I think where AXREM comes in and where the manifesto comes in is highlighting myself and David and all the other members of the special focus group are on the ground visiting NHS sites day in, day out. We're getting feedback from the staff in the NHS. We're seeing what's needed, and having AXREM as a voice to push forward what we're seeing and put that on a plate so that other members and we can support staff in the NHS and the NHS to adopt the new technologies and sort of almost reflect to say that we see the problems there, they see, and we're trying to come up with a solution as well and join voices really. What do you think, David? Because obviously you've come on board since we released the manifesto. You've been great in supporting it in discussions we've had with MPs, with Radiotherapy UK, and I guess you're the cup holder, if you like, of the manifesto going forward. And obviously you're at the cutting edge as well of technology and seeing the changes in the NHS. Do you think that the manifesto is still relevant today as it was when we launched it a couple of years ago?
In all honesty, I would say yes. I think what we covered at that point in time is still a huge number of the challenges that we face today. And although we are seeing progress, I think we still have a long way to go in a number of areas, and they're not necessarily things that are going to be solved quickly. When we look at the staffing side of things or even implementing new technology, there's lots of other pieces that are needed to enable that. And it isn't a quick fix. It's not a simple throwing money at something. And that's where the work we've done around this cancer plan, I think, becomes increasingly important, because we have to acknowledge that there is no immediate solution where we click our fingers and everything is great tomorrow. But what we need to do is we need to work together to make sure that in 18 months, 2 years, 5 years, 10 years, we're always in a better place than where we were before that. And I think that's kind of where this plan goes, by identifying sort of the short-term and long-term aspects of this. I mean, if we look relatively recently, we've had this funding for machine replacements, which is a great step, and that has enabled centres to replace aging equipment with newer machines with better capability and more efficiency. That's progress at the end of the day, but we need to keep this progress. And I think that's where the manifesto really looks at some of the more long-term challenges that we need to work on. So from my side, I would say that, yes, a lot of the core aims of that are still very much the core aims today, but I think we also have to see the successes and the wins we have along the way that at the end of the day improve the quality of care that we can provide the patients in the immediate future. I think another piece, just to highlight from the group perspective as well, is that from a AXREM special focus group within radiotherapy, we're very well represented across the treatment machine manufacturers, the distributors who supply everything from dosimetry, surface guided radiotherapy, and all the ancillary devices. We have great coverage across that, and I think not only are we well represented in terms of companies, but I think we have a great group of people in the room that we sit together and everybody leaves their hat at the door when we walk in, and we work together to really look at how we work together to bring the quality of care as a whole up, rather than just for the benefit of our own manufacturer. And I think that's a really key and important thing that, from speaking to my colleagues in other regions, doesn't happen elsewhere. And I think that's hugely valuable, that we can look at trends and technology as a whole rather than vendor-specific things, and how we can then implement that across the NHS and beyond. So, yeah, I think the work that we've done up until this point has been brilliant, and we're already starting to see the benefits of this. And I think that theme needs to continue moving forwards, and I think we have the right people in place to do that. So, yeah, I think thank you for your work up until this point, and thank you for your ongoing support, because you've played a key part of this.
It's all part, and I think you've hit a couple of nails on the head there. It's about partnership, and I've always felt, as being part of AXREM and the special focus group, we're actually playing our part in radiotherapy. It's not just about selling bits of kit in and out and working for our respective companies. It's actually playing our part in the radiotherapy community, and sort of, yes, it's great that we've had some great wins and we've been part of those great wins, the 70 million funding that you mentioned. But it's really how we evolve going forward. And I think you and I know, as the members know, that changes in radiotherapy take a while to take effect, because building bunkers, installing Linux, commissioning machines, installing software, delivering new phantoms and delivering new treatment techniques, these all take time, and you need a plan, because otherwise in radiotherapy you're going to treat today what you treated yesterday, you're going to treat exactly the same tomorrow, and yet everything's moving forward, and unless there's a mechanism and a realization to adopt that within the NHS, then I think it could be a bit of a shame. And especially as we're seeing the cancer incident increasing year on year, and everyone knows that it's a growing burden. And one thing I do seem to remember was the diagnostic hubs, the big political announcements around the diagnostic hubs, which was really, really good, because you imagine if you're a cancer patient or you suspect you've got cancer, being able to go to a diagnostic hub and have an answer sooner rather than later is a good thing. But if you are unfortunate enough to have cancer, but then have to go into that waiting tract for treatment, that sort of 62 days. And I think that's where we can play our part, because what annoys me more than anything is seeing someone important talking about radiotherapy stood next to a CT machine or an MRI machine, because that just really demonstrates that they don't get it. They don't get the value that radiotherapy offers to cancer patients, and how it's a really good treatment technique for cancer.
And just picking up in the manifesto on some kind of facts and figures. So this one, literally, whenever I hear this, I watch like Celebrity Bake Off and stuff, and at the end of it, it says 1 in 2 people will develop cancer in their life. You just think, wow, sort of someone in my household, well, probably 2 people in my household, one day may have cancer, and that actually just puts goosebumps on my head. But it's just one of those figures that I think, wow, I can't believe 1 in 2 people will develop cancer. But people live longer with cancer. Survival in the UK has doubled in the last 40 years. Cancer is growing twice as fast as other diseases, and is likely to become the leading cause of death globally in just a few decades. That's a really scary fact. Radiotherapy is of direct benefit to 50% of all cancer patients, but analysis suggests that up to 24,000 people are not receiving the radiotherapy they need as part of their cancer treatment. And that kind of leads me on to a question that last October, the government announced 70 million funding in radiotherapy. You guys work the other side of the fence of where, seeing the funding. What's your kind of update on that? Are you seeing that funding come through? Are you seeing plans for that funding? Is there a structured approach to that funding being deployed?
Yeah, I mean, I could take that to start, Dave, and then hand it, and you sort of chip in or hand over. But I mean, obviously, any funding is really welcome. The machines are very big capital pieces of equipment. They take a long time, a lot of planning to put in, to commission, to use before they actually treat a patient. So you're talking almost sort of 12 months in the whole, from sort of pressing the button and saying we want a new LINAC to actually delivering it and treating a patient. It's roughly a 12-month process of planning, of staff working overtime, particularly if they haven't got any breakout bunkers. So it was an amazing success, and really pleased that we got the funding. But it's that key word before it, the sustained funding, because whilst these machines are being replaced, the next set of machines are reaching the end of their life, and it needs to, and we're going to be in the same position. And I mentioned doing what we did yesterday, today, and tomorrow, we're going to be back in that same position. So it very much needs to be sustained, and it needs to be linked to a national cancer plan where we're looking at that. You mentioned the increased volume of patients are living longer, which means patients are having more comorbidities when they're coming for treatment. So the treatments are taking longer because it takes. I was in a hospital last week where they were saying that the standard 15-minute treatment slot isn't actually long enough to treat some of their patients, purely because you've got to bring them in down the maze, set them up on the couch, and that takes time. If you've got patients with dementia or comorbidities, so cardiovascular problems, renal problems, you need to spend more time with those patients, setting them up to make radiotherapy effective. So it's kind of like a double whammy on both sides, really. It's great for funding, but we've got this onslaught, the constant waves of patients coming through, and it's how we manage those going forward.
And Dan, sorry, something that I talk about and sound like an absolute broken record is that long-term sustainable funding. And we see that trusts wait for central funding. So in diagnostics, we had that 200 million. Obviously, there's been more announcements, and you've got your 70 million. But trusts need to put a percentage of their annual funding into radiotherapy and imaging, because our age profile of machines in the UK is one of the lowest in Europe. And as having our fantastic NHS, that should not be the case. So that's what I'm kind of really banging my head against a brick wall sometimes, saying, come on, we need to have long-term sustainable funding, and we can't rely upon announcements every 2 or 3 years on a big central funding.
It's known as the LINAC fairy in the radiotherapy world. Everyone gets very excited about the LINAC fairy coming around, and disappointed when the LINAC fairy doesn't turn up. And it's kind of that feast or famine mindset, and it must be so difficult for CFOs of trusts to plan out their spending when there's pressure on budgets at every angle, and sort of hoping or planning that you might get your LINAC paid for centrally, so that money that you owe ring fencing can go elsewhere. But it's obvious that budgets are completely stretched across the NHS. But the fact that radiotherapy is so cost effective and treats so many patients, it's that's why it needs to be on a national, centrally funded basis, really, to make it sustainable, coupled together with a national cancer plan, and then we can get the best outcomes. We can, when we put the Linacs into the departments, it's a real draw on staffing time. You're taking key clinical staff away from to attend meetings on design and construction, how they're going to manage the capacity while the installation's going on. I mean, I'd much rather those staff that are dedicated and skilled, highly skilled in treating patients, are focused on treating patients, and then the central funding takes care of the implementation of the Linacs. That would be the sort of best way, optimum use of resources all around, really.
And David, so AXREM support the all-party parliamentary group for radiotherapy, and as part of that, obviously, we work closely with Radiotherapy UK. Why do you think the work they are doing is so important?
I mean, for me, I'll touch quickly upon the previous point as well, if that's okay, just because I think there's another piece around that obviously, as Dan mentioned, this funding has come through, which is brilliant, that we have the funding for replacement. And I think there's two, in my mind, there's almost two major parts to this. That one, that funding highlighted a slight lack of understanding of radiotherapy. The money was there, and we've talked about this in the past, the money was there just for machine replacements. There was nothing in place around enabling works, nothing in place around ancillary devices, lots of things that are quite unique to radiotherapy that are needed to enable the installation of these machines, that there was no provision there within this funding. On the flip side, the fact that radiotherapy is making headlines and there is money, I think is brilliant, because that then starts to create a little bit more awareness around radiotherapy. And I think that is what we need in many ways, is an increased awareness and more knowledge of the fact that we don't have a plan around this replacement and a long-term view of what we need to do. So yeah, for me, I think there's a really important piece there, that the funding is very much appreciated, and every department who has benefited from that will be able to deliver newer technologies to their patients, which is brilliant news. On the flip side, it has caused lots of complications because the funding didn't necessarily encompass everything that they actually need to enable the installation, testing, and delivery of these machines to patients. So yeah, I just thought that's a piece to add on that front. And then, as you say, when we move towards Radiotherapy UK, I think it's a really strong connection. Many of the AXREM members are also part of that Radiotherapy UK task force. So there's a lot of familiarity from our side between the two. And there it's more around the charities. We have a lot of political engagement with them and the APPG. So I was fortunate, I think it was last month now, every day blurs into one almost, but we went to Portcullis House with Tim Farron and that was around the cancer plan. And I was there to represent industry as the leader of the radiotherapy special focus group. We had patient advocates, we had people from the ICBs, and we really talked around different attributes of that cancer plan that need to be addressed, and the view from different areas of radiotherapy as to the challenges and how we need to come together to better deliver that cancer plan. And I think for me, that was a really important piece. And that's where we have a lot of crossover between AXREM and Radiotherapy UK. And I think it's positive, because for me, we all need to be pulling in the same direction. If as a special focus group at AXREM, we're asking for something vastly different to the work we do with Radiotherapy UK, then we kind of send a mixed message. But that combined approach is really, really powerful. And I think with AXREM, we have much closer connections to NHS England and NHS supply chain and the sort of procurement landscape and funding landscape than we sometimes do with Radiotherapy UK. I think with Radiotherapy UK, we have more political aspects where we spend a lot of time in Parliament doing stuff with them. And the two really complement each other. And I think for me, it's that joined up approach of we're not duplicating work, but we're supporting each other, I think has a really positive effect overall, and it kind of brings value in different areas. So from my perspective and from a BrainLab side, it's really valuable to be part of both of those groups, because both bring their own value. And I'm sure for Dan, it's very similar. I mean, I'll let him add any thoughts that he has. But yeah, the work that we do over there is really, really good as well. And I think at the end of the day, what we're trying to do as a group is really just improve the quality of care at the end of the day for patients. As manufacturers, yes, ultimately new technology benefits us. That is part of this, but the reality is, as you say, cancer is going to impact everybody's life at some point, whether it's themselves or a family member. And I think that's where we do take our corporate hat off when we go into these rooms and we think about how can we improve this as a whole. So yeah, I think for me it's a really, really important piece to combine those two.
And seeing when you see Pat Price in the news, I mean, she's absolutely fantastic. What an ambassador for radiotherapy. And I see her on the BBC. You see the articles in the Guardian. It's really powerful stuff. And Professor Pat Price, she gets radiotherapy. She gets the political landscape. She knows what needs to be done. And Tim Farron is a great MP and a great leader of the APPG for radiotherapy. And he's really open, honest, and again, he gets radiotherapy. He'd never have a photo of himself against a CT or an MRI talking about radiotherapy. He really understands it, and I'm really sort of proud to be associated with him. When I see him on telly, even when I'm sat down with my family and I see him on TV, I sort of tell my family, I know Tim Farron, he's fantastic, and I know Pat Price, he's amazing. So it's a really good connection to have, definitely.
And just to finally add to this part of the conversation is we actually, as AXREM, on behalf of radiotherapy members, wrote to the Minister at the Department of Health and Social Care. And I've actually this week received a response from Ashley Dalton MP, the Parliamentary Under-Secretary of State for Public Health and Prevention. And basically in the response, they've said that the government is committed to investing to improve cancer care and reduce waiting times for diagnosis and treatment. This includes the allocation of around 1.5 billion of capital funding in 2025-26 for new surgical hubs and diagnostic scanners to provide over 30,000 more procedures and 1.25 million diagnostic tests. Part of the 70 million investment you mentioned was allocated to the NHS trusts to use for bunker refurbishment. All future spending commitments beyond 25-26 will be determined in the next phase of the spending review process, which will conclude in June. And we know that we're going to see what that looks like next month. So I just thought I'd kind of update you, and I don't know whether you guys have got anything to say about that sort of fairly generic response.
At least it's a response. I mean, that's really powerful to get a response.
Absolutely.
To be part of I mean, well done to you. Hats off to you for getting the response. That's really good. And I guess it's so difficult for ministers it's such a big problem to tackle. Everyone's out vying for money and vying for attention from the budget. But it's just the work that, I think, going back to that previous point, the work that Radiotherapy UK does, the APPG, in keeping radiotherapy at the top of everyone's minds, getting the MPs to debate it in Parliament is fantastic. And that's been an achievement that Radiotherapy have done over the last 5 years. I think looking forward, what's happening in radiotherapy now and is happening in healthcare in general is that the power of data, AI, cloud, that's really moving at a pace, and the software side of things is really driving efficiencies, which is what we need in healthcare. So doing twice as much with half as many people, or doing twice as much in half as much time, will help with the cancer care backlog. I'd like to see sort of more information around reimbursement, because the way radiotherapy is driven is primarily through the reimbursements of treatments, because that kind of allows or disincentivize or disincentivize treatments. There's a big drive on sustainability within the NHS through the Evergreen. That's going to become really apparent going forward from 2026. And then patient outcomes. It's all very well spending money, but at the end of the day, it's patients and patient outcomes. And sort of measuring that, I think, is going to be really important going forward for healthcare systems to measure the money in and the outcomes that are expected out. And then you can quantify healthcare and then drive improvements going forward, rather than just funding a treadmill just to get patients in and get patients out.
Absolutely, thank you for that. Obviously, we've spoken about kind of the current situation, and we've kind of touched, I suppose, on the future of the healthcare landscape generally, and obviously within radiotherapy. But with regards to our special focus group, kind of what's next? Kind of what's your plan for the group? David, do you want to kind of go on that? I know obviously it's probably quite a tricky question, because we haven't got all the answers at the moment, and obviously nationally things are changing and we're waiting for announcements and whatnot, but just from obviously your opinion now, what's next?
I mean, I'll be honest, I think some of the things that we've already touched upon, not necessarily in this call, but as a group, around the patient advocacy and patient awareness, because I think we're at a stage where radiotherapy is still not necessarily a taboo, but a relatively unknown topic for so many people. And when we look at the cancer incidence rate and the percentage of people that should have radiotherapy as part of their treatment pathway, if you mention chemotherapy to someone, they know what it is. If you mention immunotherapy, people know what it is. They don't know in detail, but they have a pretty good idea. If you mention radiotherapy, it's this huge unknown at this stage. And I think we have patient advocates like Andy Tudor who are really talking about how good radiotherapy was from a personal perspective relative to surgery. And at the end of the day, it's not one size fits all. Everybody has to have their own treatment journey. But I think creating an awareness around this as an option and as a positive option is good, because I mean, as humans, we're always told how bad radiation is and how to stay away. And I think if you go past the radiotherapy department, you have warning signs everywhere, and it seems quite a daunting experience. So I'd say one big piece is creating that awareness so the public are more aware, because if the public are more aware, let's be honest, MPs are probably also going to be more aware. And that's a big piece, is that awareness piece around radiotherapy in general and the benefit of it. I think another thing we've touched upon as well is around this sort of puzzle aspect, all the components that need to come together to really enable a world-class radiotherapy treatment or department. It goes beyond just the machines or just the software, and the staff are a hugely important part of this. So it's really demonstrating how all of this clicks together to actually deliver one overall strong solution. And I think if we want to be a leader in healthcare, which with the NHS is what we should strive to be, we have to really understand what we're trying to do first of all. And I think that's where there's a lot of potential at the moment, is generating a better understanding, whether that is the public or around funding or even within the NHS England, although obviously with the news of NHS England, we'll see what happens there. Just as to how we put this together to really deliver the right solution to hospitals and therefore to the patients at the end of it. So for me, they're some of the key points that I think we can really focus in on and have relatively quick wins in terms of start to create that knowledge and the understanding of the requirements to move forward. Actual moving forward will take a little bit longer because that requires funding and a cancer plan, but it's putting those pieces in place so that we're on that right journey. And I think as under Dan's leadership, we've kind of got to this point that we're moving in that direction, and now he's passed the reins over to me to make sure we see it through. So no pressure, and thank you, Dan. But yeah, from my side, I think those are a couple of the key components as to what we need to really keep pushing forward and keep the momentum that we're starting to get.
I agree, David. I think it's like you sort of covered the points there that around the puzzle, which all the bits of the puzzle that form radiotherapy and the patient journey through radiotherapy. And it's just, I think we're the right people, and AXREM is the right vehicle to explain that and to publicise that, because I think, again, going back to that scenario of the right person in front of the wrong machine, it just shows a lack of understanding. That goes through, as you mentioned, to the funding, that was just for the equipment, not for the room enablements, and the time constraints that are involved. And so if we sort of put all those bits of the puzzle together, that'll help everyone understand radiotherapy, that it is a ship that needs to be, that's on a course, and to change the course does take time. But if you plan ahead and you've got a plan, we can change the course and we can adopt new technology and be more nimble. But I think it's our role to put forward that understanding and bringing the patient voice into it. I think is really key as well. As you mentioned, and with Andy, he's a great patient advocate. You sort of, if I googled patient breast cancer, and you can sort of still even today see blogs and questions of patients that are asking, what's radiotherapy? Is it going to hurt? And it's this kind of stuff that I think we as a community can address from our side as manufacturers to put forward the facts, so people have more informed information when they go for treatment or they go for their consultation with a clinician.
I mean, you've mentioned something there actually, which reminded me, because a shock when I first joined BrainLab was the fact that to our UK sales inbox, we used to receive questions from patients or patients' family members about treatment, asking us for advice on what they should have or where they should go for these treatments. And I'll be honest, I was shocked when I first joined that the OEMs were being asked these questions from patients and their families, because there wasn't the resource and wasn't the education necessarily there for those people to find out what they needed to without coming to us. And now I kind of take it for granted because it happens frequently and we see those kind of messages. But yeah, you touched upon it then, and I think that was something that was really eye-opening for me. And yeah, there's just isn't that information readily available for people, so that the patient advocate piece becomes increasingly important, because having someone who's been through it and experienced it and can share those experiences and almost guidance for patients is so invaluable. I mean, it's such a difficult part of your life when you or a family member receives that diagnosis and your whole world turns upside down, that to then struggle to find the information that gives you the reassurance or the knowledge that you're looking for, it must be even more difficult. So I think that's a really, really important part of this.
Yeah, and I think just wrapping up that conversation, I think the future of the radiotherapy special focus group will very much be driven by the spending review and the 10-year plan. So obviously next month we're going to analyse that inwards, outwards, backwards, forwards, and make sure that we clearly understand the areas of that affect our members, and that will very much be brought into our core work and how we can support members. So just thinking about AXREM more generally now, I just wondered if you could both just tell me what you think the benefits of being involved in AXREM and the special focus group is.
Yeah, sure. I mean,
Dan first, yeah.
I'm happy to kick off that. So when I first started joining AXREM, I didn't quite know what it was all about. I remember reading the website. I talked to my colleague Richard about it and talked to my other colleague Neil Harvey and said, what's all this about? I'm interested to go and find out. I remember going to the first meetings, and I was pleasantly surprised how welcoming it was. Everyone's completely open and honest and transparent. It's a really good format. Everyone gets a voice at the table. And the more and more meetings I got into the rhythm of the meetings and understood where the chairman was running meetings, what you were trying to drive within the meetings. So from a personal point of view and my career development point of view, it was great to understand how Elekta slots in with all the other manufacturers. But from a company point of view, it's really important for me to feed back to the company about the marketplace developments, things that are stopping the adoption of technology. You know, we've got the special focus group around AI. We've had issues with DCB 0109s, cybersecurity, that sort of thing. And for me to explain that internally to Elekta was quite difficult on my own. But being part of the group, I have that information, I have that resource. And we talk about it in the groups, and I'm able to feedback. And then I'm also able to bring things to the table that affecting Elekta in the business. So it's a sort of definitely a two-way street from a business point of view, but from a personal career development point of view as well. What's it been like for you, Dave?
I mean, I'll be honest, I think it's very hard to follow up that, because I think that was a very good...
Well, for me, I live quite close to London, so for me, it's just jumping on a train and 40 minutes from London. But I know you live a lot further away and you make a lot of effort to come down, so it must be important to you.
It is. It's invaluable, I would say. And for me, the other piece of this is that when I first joined BrainLab, we were already an AXREM member, but I feel like we sort of floated on the outskirts. We weren't necessarily particularly active in the group, and we used it more for information and understanding, and almost the more I've engaged with it, the more I've got out of it. And now, I mean, I can say we're part of the sustainability special focus group, and that for us as a small organization, when we look at the evergreen assessments and things, was incredible. We really had very little idea of what was required, what we needed to do, how we were going to bring the resources together to do that. And for us, that group and that knowledge, and especially when we look at some of the openness of the bigger manufacturers as well, they share a lot of information. And it was this sort of combined approach of everyone within that group was happy to support each other. Although we're competitors, as soon as a tender comes out, in that environment, everybody was willing to share information and support each other. So that for me was amazing. And then when we look at the radiotherapy special focus group, it's the information, the knowledge sharing, and the strategy side of things, because every company has a different focus within what the key part of their organization is, whether they're a distributor covering a number of devices, or a linac manufacturer focused on machines, or a company specialized in surface guided radiotherapy. It doesn't matter what it is. We all bring value to these meetings. And I think the more people we have, the more value we bring, because we encompass radiotherapy in a greater way. We mentioned this puzzle before. if people aren't there or we don't have that topic covered, we're missing a piece of that puzzle, and then it cannot be complete. And I think that's one of the really important pieces for me, is as this group's grown, I think our knowledge around the area of radiotherapy, I mean, we also have AGEA, who don't manufacture equipment at all. They provide managed equipment services, which is an increasingly important part of the radiotherapy environment as well. So it goes beyond just the technology that we all provide. There's so many pieces to this. And yeah, from my side, it's the entirety of that information really, it is going to steer the direction of radiotherapy for the future. So to be part of that means we're part of that steering group, and to have knowledge and understanding, and as you say, the sort of market trends from a commercial side is also very, very important. So yeah, I think there's a human element of, I want to know what's going on, and I want to make sure that we're all working towards a better quality of care for the future. And there's also the commercial element of, it is beneficial to the OEMs to be part of that, because we have better insights of the market, we have better knowledge of what's coming up, and we can steer it in the direction that we need it to go. So yeah, it kind of encompasses everything. I think my summary would be, the more you put in, the more you get out, in all honesty.
And do you know what, David? I was just about to say my favourite sentence when I'm speaking to a potential member is, you get out of AXREM what you put in. If you join and you don't get involved, you're not going to get anything out of it. But the more you get involved, the more information you gather, and the more useful that can be to you and your company.
There you go. You can put that one for free, Sally.
Don't forget the Christmas do, Sally.
The Christmas get-togethers are also very, very good. So I shall hand over to Mel now to lighten the mood a little.
Yeah, so on to my quirky question, guys. So if you had a time machine, would you go to the future or would you go back in the past, and why? So Dan, do you want to go first?
Yeah, I'd go to the future, because I think radiotherapy is going to change massively over the next 3 to 5 years. We're on the verge of the next major thing in radiotherapy. Everything's kind of set. We've got more patients than ever, patients being diagnosed, but more patients to treat with fewer members of staff, fewer equipment. So it's a real coming together of technology, of what we've got established. So that's why I'd like to go to the future, because it's going to be really interesting to be part of it.
Absolutely. And David?
I feel like Dan's given too good an answer there. This makes my life very difficult.
Sorry,
I will say to the past, just to add some contrast here then. Music was better, my back ached less. We can go back and make sure they created a plan 15 years ago so that we're in a better place tomorrow than we are today. As Dan said, I think the future is going to be a very, very exciting place. There's so much evolution within radiotherapy at the moment. If we look, almost every few months there's some new technique or there's something new happening, and at the end of the day it's all to benefit patients and to improve what we can deliver. So yeah, I think the future is bright, and I think what we're working on right now is really good, and it will be great to see the benefit of this work coming to fruition. So yeah, I'd say from a realistic perspective, the future is very good and very exciting. But for contrast, I'll take a younger back and a slightly less weight down the middle from the past.
And also, if you go back to the past, you would have fallen off your bike less.
Yeah, but then I might have to break bones again in that sense.
Oh, thank you so much for joining us today, David and Dan. I think we've got a lot more insight into the AXREM Radiotherapy Special Focus Group. So a big thank you to Dan and David for joining us today, and thank you to all of our listeners.
Join Sally and I again next week when we will be speaking to Bob Child and Saduf Ali Drake-Smith regarding the AXREM Imaging IT Special Focus Group. If you've enjoyed today's podcast, don't forget to hit subscribe, or feel free to share the podcast with friends.